Hello, everyone. My name is Mimi. I am the Student Services Counselor for the Community-Oriented Public Health Practice, also known as COPHP, Masters of Public Health program at the University of Washington in Seattle. Welcome to the COPHP webinar. This presentation is roughly 45 minutes and is aimed to introduce you to the mission, structure, and expectations of COPHP. Know you can always reach out to me if you have any questions or requests. I'm always excited to make connections to current or past COPHP students, teaching faculty, and program leaders. My email is in the top right-hand corner of this slide. Again, my name is Mimi, and I'm your lady from application to graduation. Let's jump into the webinar. So the COPHP program is very mission aligned, so I want to get started by reading the mission and goals with you. The mission of COPHP is to prepare students to be problem solvers, advocates, and leaders in community health. By combining an active style of learning, what we call problem-based learning, rigorous academic preparation, and a commitment to social justice and community engagement, we're a 2-year full-time program that equips graduates with the knowledge and the skills to effectively address public health challenges. Additionally, an important element I always like to touch on early in my webinar is the fact that COPHP's faculty, students, and curriculum have made a commitment to work towards becoming an anti-racist educational program. We've made changes in recent years to invest deeper into this work, and I'm always happy to address any questions you have regarding what this work means to COPHP. So our program goals are based on a common set of core MPH competencies that are in place for all University of Washington students seeking a master's in public health. You can find them on this competencies website, but it's important to note that COPHP has taken all these baseline competencies and massaged them into action statements, so students can not only understand them, but have many opportunities to apply them as well. These learning objectives are threaded through COPHP's coursework, mentorship, research, and training opportunities like practicum and capstone. The term learning objectives is also super common in COPHP, as that is what we call your homework assignments as well. These are some of the program's learning objectives that you can expect to master during your time in the COPHP program. You'll notice once again that all of these are in action statement format. That's because, again, COPHP is rooted in action and practice instead of other programs' approach to working in theory. Some of the LOs or learning objectives that you'll meet after completing the program is how to assess community assets and needs, how to engage and mobilize communities around public health challenges, how to evaluate health programs and policies, how to challenge the causes and effects of poverty and racism in our communities, how to develop, implement, and manage public health programs, and how to identify and address social structures and policies that create and perpetuate health disparities. Again, this is only a small proportion of all the learning objectives you'll achieve while in the program. So let's get into more of the specifics about the program. COPHP cohort sizes are small, ranging from 18 to 27 students who start in the fall quarter. This is in comparison to the other larger MPH cohorts that have hundreds of students in their classes. We're designed for providing master's level training to be an effective and responsible public health practitioner. We often get asked what a public health practitioner is, and I like to describe the role as someone who ethically approaches communities, flips the microphone around to ask the community members what is working for them and what isn't serving them. Practitioners then use their privilege, power, and credentials to bolster up what is working for these communities and dismantle what isn't working for these communities. Practitioners are rooted in theory, but driven by actions to improve community health by centering community voices. In order to apply to our program, we require a bachelor's degree, and the program itself strongly recommends applicants who have at least 2 years of work experience in public health by the time they start in the program. The reason for this is due to our approach to problem-based learning, where students draw from academic, professional, and personal experiences to inform the collective knowledge in the room. Although this is recommended, COPHP does practice holistic admissions and understands unpaid and lived experience is greatly important to your understanding of public health. COPHP is unique in that it is rooted in problem-based learning. We don't focus on lectures and assigned readings. Rather, we focus on a case-based approach and an active learning environment which is the opposite of lecture or didactic. Our learning is self-directed, and although faculty are present in the room, the students really facilitate their own learning. If you're familiar with problem-based learning, I encourage you to do a little bit of research on that outside of my presentation. I also encourage you to do a quick Google of active learning or adult learning theory, where we are also kind of centralized as well. So what is PBL for COPHP? As I mentioned, students take charge of their own learning, and the classroom setting is based on cases about real world issues in public health, not traditional methods like lectures, tests, and textbooks. There are very few exceptions to the no lectures, tests, and textbooks rule. One course being our analytic methods course, where you learn and apply RStudio coding, which is a statistical software used for data analysis. This course includes an asynchronous recorded lecture once a week on top of PBL. It's also the only COPHP course that has an exam. So outside of that exception, COPHP instead uses instead of lectures, tests, and textbooks, COPHP students work in small 7 to 10 person groups or sections to work through cases about specific public health issues written through the eyes of a public health practitioner. You'll work together to analyze these cases and develop solutions to these public health issues. Although that faculty facilitator or instructor is in the room during PBL, students are the center of the show, and each case has a rotating student facilitator that will guide their peers to the learning objectives threaded within the case itself. PBL and COPHP is student-centered and team-based. PBL courses are 3 hours long and meet twice a week, so students grow immensely in their facilitation and discussion skills during their 2 years in the program. Every case has multiple learning objectives weaved within, and students work to identify key questions that need to be addressed, not only to understand the public health problem better, but to go a step further and explore potential solutions. These learning objectives become each student's homework assignment for that class period. An example of a learning objective question that a COPHP student would synthesize with their section in class to better understand a case is describe effective practices for ethical data collection with communities. So that's an example of an assignment. By the time students graduate, they will have met over 250 learning objectives by processing over 50 cases and completing all the other amazing things in the program like practicum and capstone. We'll get into more detail about the class flow and structure a little bit later, but let's zoom out a little bit and look at the overview of the program. COPHP is a generalist degree. So this means rather than focus on one specific area of public health, like global health, for example, we learn about all the pillars of public health like epidemiology and biostatistics, policy, evaluation and management, environmental health, social and behavioral sciences, and more. With that, some students do decide to focus in a specialized area by concentrating their electives in a specific topic or completing a certificate program in addition to COPHP's requirements. Also, the focus on COPHP is always real-world practice. So instead of a thesis, which often lives in theory, COPHP students complete a practicum and capstone project, their first and second year respectively. But both projects are time-intensive, immersive experiences with community-based agencies or organizations where you'll produce a deliverable to that agency that will be immediately adopted into their programming. We'll get into this a little bit more, but the projects for capstone and practicum are extremely impactful and ensure our students have real-world experience managing high-level projects so that when they graduate, they are much more competitive within the workforce. So COPHP is an in-person program, meaning we do not have a remote or hybrid option available. Our program is 6 quarters. There are no classes during the summer between your first and second year. We are also a full-time program, meaning students rarely work more than part-time or even at all during our working through our program. Classes take place in fall, winter, and spring quarters, which are each 11 weeks long. The academic year spans the end of September to the beginning of June. Courses are provided in a specific order and cannot be taken out of order or outside of your cohort. What you see here is actually the full list of credits required for graduation. The 36 core courses or PBL courses are spread over the 2 years. Each course for PBL is 6 credits each. There is 1 seminar credit per quarter for COPHP seminars. COPHP students take 2 credits of practicum each quarter their first year, and then 9 credits of capstone are split between the entire second year. We only require 6 credits of electives due to the rigor associated to the program, but you can take more if you'd like. We also don't gatekeep electives and want you to take advantage of UW's impressive graduate course catalog. It doesn't matter if you find a graduate course in the School of Law, Medicine, Education, or others, as long as it's a 500 level or above and the instructor hasn't put restrictions on the course, you belong there. Our students have very diverse expertises and interests, and we want you to grow spherically while at UW. So diving into the first year required courses for COPHP, we refer to our PBL courses as blocks. Your problem-based learning course or PBL course for autumn quarter your first year is Population Health and Community Development. You'll always take a COPHP seminar each quarter that complements the content you're learning in your PBL class. For winter quarter, your PBL class is Analytic Methods, where you learn how to code in RStudio, interpret complex public data sources, and work through heavy data. Spring quarter PBL is Health Behavior and Health Promotion, as well as Environmental Health. Reminder that the first year service learning experience is practicum, where students work for a community-based agency or organization of their choosing, addressing a specific public health question or problem through an impactful deliverable, such as a needs assessment, curriculum design, evaluation, or even a peer-reviewed publication. Similar to an internship or an apprenticeship, practicum amounts to roughly 160 hours of site work. I find it helpful to show prospective students a schedule of their first year in COPHP. Again, UW is on the quarter system, so the columns here are autumn quarter, winter quarter, and spring quarter. The big blue class you see in the middle is your problem-based learning class that will meet twice a week for 3 hours each session. You can appreciate that we have 3 sections here of PBL per class. The way that we do that is we take our cohorts of roughly 27 students and split you up across these sections. So you're in small groups of 7 to 10 students per instructor. These section assignments are mixed up every single quarter. So by the time that you graduate, you will have had a class with every student in your cohort. The course's team of instructors, for example, in population health, Haley, Kendra, and Barbara, collaborate to write your cases for that course. Each section processes the same case during the 3-hour period, but the difference between the sections include obviously the instructor, the time the class is offered, and the community-based organizations they work with on big projects. These project connections are facilitated by that faculty experts network and often change year to year. This orange class under PBL is seminar, where your entire cohort will meet once a week for roughly 80 minutes to hear from visiting speakers that come and talk to your class about how the information you're learning in your problem-based learning class is actually applied in the speaker's public health practice or work. This class doesn't have assignments, but often proves very valuable to connect students with potential sites, projects, and advisors for capstone and practicum projects. That final green class in the bottom of practicum. Jasani Henry has been our practicum director forever. He was actually graduating in the first class of COPHP, and a lot of our faculty in our program are alumni as well. Going back to Jasani, in conjunction with his position as our practicum director, he also works full-time for Public Health Seattle King County. And he spends his whole year shepherding current students through their practicum projects. And he also uses his amazing network to identify impactful and directive projects for future students like yourself. So when you start your first autumn quarter in COPHP, he presents a list of many projects, often more than we have students for, which you will rank and be placed in to start that work, come winter quarter. So you'll start that 160 hours closer to winter quarter. You also have agency within this practicum experience as well. If you come into COPHP with a clear idea of what site you want to work with and a specific project, Jasani will work with you and that site in autumn quarter to make sure that the project is doable in 160 hours on an academic timeline, the project meets the expectations of COPHP, and that you're supported from all sides. At the end of practicum, you'll hand off your deliverable to the site, give a presentation there, give a presentation at UW, and you'll be a second-year student. For both experiential learning projects like practicum and capstone, you'll have a faculty advisor to be a helpful point of contact here on the UW side, as well as a site supervisor who will act as your day-to-day manager at that site to make sure your deliverable meets the agency's needs. Practicum and capstone projects are intended to build your transferable skills, widen your public health network, and get you ready for your dream career. So we invite students to pick these projects up and run with them. So let's talk about what a week in the life of a COPHP student actually looks like when it comes to PBL. So in terms of the day-to-day rhythm of PBL, here's what to expect. As I mentioned, you meet twice a week for PBL. For first year, PBL is often on Tuesdays and Fridays. For Tuesday's class, you'll get in and start with an icebreaker created by that rotating student facilitator. Like I said, that student facilitator will have already met with the instructor to go over the case to find those hidden learning objectives. So after that icebreaker, guided by the facilitator, everyone will thaw out, and the facilitator will distribute a printout of a case about an issue in public health written in the perspective of a public health practitioner. You will all read the case individually and pull the information through the lens you've created from your experience in public health. Whether you pull from personal, professional, or academic experience, you will start to identify things you know to be true about the case based off of your experience in public health. As you identify things you know to be true, you'll also start to think of questions that need to be answered to better understand the problem the case is describing. This highlights the importance of having a lot of experience in public health by the time that you start in the program. Past cohorts have been made up of physicians, social workers, educators at all levels, policy advocates, and importantly, people who have lived experience, such as those who have experienced houselessness or are undocumented. We find that when all of these amazing voices and minds get in the room, they can think about problems from a solution-driven position and want to learn deeply with their communities at the center of the conversation. So after you're done individually processing the case, you'll all come up for air and start to engage in a discussion about the case. This is where your entire section will all share the things they all know to be true as a team. And then as a group, you'll identify 7 to 10 questions that you all agree would help deepen your understanding of the case and lead you to a potential solution to the problem. Everyone walks away with one question or action item that becomes your homework assignment for that day. These action items are those learning objectives we touched on at the beginning of the presentation. An example of a question you'll be asked to address in PBL or have a homework assignment for is, what are some systematic differences between accessing healthcare in Seattle versus 3 hours away in Vancouver, Canada? The most common type of assignment you'll do for COPHP to address your learning objective question is a 5-page research paper. You'll upload that 5-page research paper onto Canvas, which is our online learning tool, the evening before your next class, shown here on Thursday around 6 p.m. After you upload your paper, you're required to read everyone else in your section's paper before the next class period. These assignments that you're writing essentially become the textbook that your cohort and section is writing for the course. COPHP students learn by consuming research in many forms and in turn packaging it up into effective communication to teach their peers. The accountability to your peers in COPHP cannot be understated, as you are only given 2 to 3 days to produce these assignments, and you are effectively in charge of your peers' understanding of the material. We all know this pedagogy isn't for everyone, and that's okay. But if you learn by doing, thrive in teams, and want to lead your own educational experience, this is the program for you. The following day, Friday, when you get into class, after that icebreaker, your section will undergo a debrief where your section may split up and discuss each other's paper or have an open forum to resolve any remaining questions, allow for respectful feedback, share any resources that proved helpful, and then often progress to the next layer or day of the case. Some cases are built like upside down triangles where you start off high level and surface level. And then with each layer, you dig deeper to the foundations of that issue. This is the rhythm for every single PBL class. It goes case analysis, identify the question, address the question, and then move on to the next problem. Like I said, a lot of these assignments shown here are 5-page research papers, but many classes bake in really cool group projects, especially in the middle and end of the quarters, where you will work with a community-based agency or organization on a deliverable or a question they have. For example, your section may complete a needs assessment for Mary's Place, a local nonprofit that provides safe, inclusive shelter and services to families and children in need. Another thing that's important is COPHP has a huge goal in teaching students the skills necessary to reach their specific audience, whoever that may be. So for some of your assignments that you see here, you'll practice how to connect with specific communities in specific ways, such as infographics, social media campaigns, policy briefs, lightning talks, community meetings, public health curriculum for high schoolers even. We want you to be able to do it all by the time you leave our program. For your second year as COPHP, your autumn quarter PBL class is health policy. This class is amazing, and last year we had an amazing project at the end where our students created a deliverable for one of our state representatives that was actually brought to the floor to push policy forward. I love talking about it. Go and read about it on our Facebook page. But autumn quarter PBL is health policy. Winter quarter PBL is participatory evaluation and community organizing. Then in spring, PBL is management and leadership. This final quarter is super reflective and gets you ready for the next step in your career by analyzing cases around managing public health projects and leading programs and ethically working with communities. You'll have alumni workshop events and networking options and other professional development experiences this spring quarter as well. Once again, for every quarter you're in COPHP, you'll have a COPHP seminar where public health practitioners and community leaders will come and reinforce the information you're learning in PBL and show you how it's applied in practice. And then instead of practicum, for second year, you'll have capstone, which is a much larger project that you will create from the ground up. This amounts to completing roughly 360 hours of work at a site of your choosing, again, working on a deliverable to address a specific public health question or need within a specific community. Students can specialize in an area by building off their practicum projects or diversify their connections and skills and work with a different organization, community, or method. Students build out their support teams by choosing a faculty advisor and a site supervisor. We also have a capstone director, Jenya Shimkin, who is another alumna of the program and still actually runs for capstone to this day as a nonprofit. Jenya requires students complete contracts, proposals, and literature reviews with other checkpoints throughout the year to make sure that they're on track in their project. At the end of those 360 hours, second year students present their capstone work at their site and at UW and go off to graduate and change their communities for the better. So specializations, as I mentioned before, there is an option to specialize within our generalist degree. You can do this one of two ways. One is by completing a certificate. There are many certificates at UW, and the most popular ones with our students do not have an additional cost associated to the certificate. It just takes some careful course planning to meet their requirements, which is often 12 to 15 credits of additional or complementary coursework. Alternatively, you can concentrate your electives in one area of study. For example, this link takes you to a list of environmental health courses that UW offers. Keep in mind, it's also possible to earn a dual degree within COPHP. We have 2 concurrent degree opportunities to obtain a master's in social work or a master's of urban planning while completing your MPH in COPHP. I strongly encourage you to reach out to me if you are interested in pursuing this concurrent degree path to talk through the 3-year timeline, course plan, and cost implications associated. I'm excited to let you know our application for the 2022 cycle is officially open. They open on September 1st and they'll close on January 15th, 2023. Keep in mind, our deadlines are different than the School of Public Health programs, the other School of Public Health programs here at UW, so be aware of that if you're applying to multiple programs here at UW. If you're viewing this recording after our deadline has passed, reach out. We may accept applications submitted after the deadline on a space available basis. We communicate decisions in mid-February and have our cohorts confirmed by April 15th or early summer. COPHP has overhauled the application process, and we are now on SOPHIS, a centralized application service for many MPH programs. I think it's over 140 schools. It's important to note, though, that applicants must also submit a MyGrad application through the UW Graduate School to be considered for entry to the program. So 2 applications. Both applications have the same deadline, but request different information. SOPHIS is where the bulk of our application materials are collected, while MyGrad acts to establish a formal pathway for you to enter as a UW student if you are accepted by the admissions committee. Again, we need both to be completed to be considered for the entry into the program, and we will communicate our decisions via MyGrad, as well as emails and letters and all that good stuff. So the first 2 bullet points here are required for any graduate program here at UW. First, you must have a bachelor's degree from an accredited college or university in the United States or its equivalent from an international institution. If you're unsure if you have a degree from an accredited college, reach out to me and I can totally help you figure that out. As well as the other requirement being, if English is not your first language, you must demonstrate English proficiency either through testing or by holding a degree from an institution primarily taught in English. We prefer a minimum of a 3.0 GPA on a 4.0 scale for the last 60 graded semester credits or last 90 graded quarter credits, but we have made exceptions to this point in the past. Again, we strongly prefer applicants have roughly 2 years of post-college work experience in public health by the time that they start in the program, due to PBL being highly informed by individuals' experiences. We have a section in our SOPHIS application that asks you to address any areas of your application where you may kind of want to provide a little bit more clarity. So if you're at all unsure about where you sit with these minimum requirements or are strongly encouraged, feel free to use that space to kind of provide more context to us and inform us. We, again, practice holistic admissions. So here are the application materials required for this admission cycle. Again, you must submit both a SOPHIS and MyGrad application to be considered for entry to the program. You must submit transcripts from every college or university where you've earned a degree or took relevant coursework. We also ask for a resume or CV. I encourage applicants to be inclusive to capture all of your public health experience. So volunteering, conferences, mentorship, internships, study abroad programs, unpaid work, all very relevant. We need 3 letters of recommendations in SOPHIS. One recommender specifically should be able to speak to your readiness for graduate school. So maybe a past college instructor or someone that has an advanced degree and can speak to your readiness for such a rigorous program. We also have you submit a problem statement in SOPHIS. We ask you to talk about an issue in public health that you're passionate about and how you could explore solutions as a COPHP student. Know that there isn't a right or wrong answer to this question. We want to get a glimpse of the hopefully real scenario that if you were in a PBL class and a faculty handed you a case about an issue that you knew a lot about and cared deeply about, how would you impart that knowledge you have to your peers? How do you qualify your passion with your experience and vice versa? How do you want to work on this problem as a COPHP student? Remember, our program is based in action and not theory. So consider how the program will prepare you to address and understand the problem better while as a student and later in your career. We're piloting a new requirement this year of a writing sample where you are the sole or primary author. Examples include a past paper or report from an upper division course in undergrad, a policy brief, a publication, an op-ed, or communication you made for a specific audience. Since our assignments in COPHP are heavy on writing skills and reaching your audience, we want to see an example of your success in doing just that. Again, if English is not your first language, we'll either need TOEFL or EILTS scores. I'm excited to report there are multiple opportunities to waive the cost of your MyGrad application. I encourage you to review both of these policies to see if you're eligible. The UW Graduate School fee waiver policy includes a financial need clause that doesn't require any documentation, and I'm a big fan of that. The MPH fee waiver policy states that if you provide documentation saying you're associated with any of these organizations or even just attended a conference, we'll actually go in and pay your application for MyGrad fee for you. Keep in mind, you need to send a waiver in at least 7 days before you actually hit submit on your MyGrad application. Unfortunately, we cannot reimburse you after you've submitted that application. SOFIS application fee waivers are available and controlled by SOFIS, so please contact them early in the admissions process to see if you meet their eligibility. We find that COPHP applicants who are able to articulate how the program's unique attributes align with their learning style and career goals are often successful in applying and being invited to the program. It's also important for applicants to be able to demonstrate how their academic work and life experiences have prepared them to be successful in this very demanding and rigorous program. The biggest thing with COPHP is understanding the expectations placed upon you as a student are different than other programs with lower accountability learning structures. We want you to be excited about the opportunities offered to you in the program and not resent the work associated. So always review your materials to make sure that you are communicating, you understand our expectations, and you're ready to do the capital W work. So I'd like to touch on the program's cost. It's important to note that COPHP is a fee-based program, not a tuition-based program, where the amount you pay quarterly is informed by the residency to the country or Washington state. So we don't do tuition, we do course fees. The estimated cost of the degree, if you were to start this year, is just over $61,000 across 2 years. That calculates to roughly $10,199 per quarter for 6 quarters. This is a flat rate, whether you are a Washington state resident, from out of state, or an international student. This amount includes all of the perks associated with being a UW student, meaning you get access to the 15+ beautiful libraries, multiple gym facilities, as well as a public transit pass or U-Pass that gets you free rides on all of Seattle's buses and light rail subways, as well as a handful of ferries. For example, I take a ferry to work every day and UW covers the cost. Keep in mind, students in fee-based programs are still eligible for financial aid, and the majority of funding awards, aids, supplements, all that good stuff. I always encourage students to triple check their contracts though, and make sure funding isn't tied to tuition, because as a reminder, you're not paying tuition to COPHP, you're paying course fees. Know that we as a program are always taking steps to reduce the financial burden on our students by nominating and creating funding awards. Last year, COPHP students were awarded over $50,000 in funding awards. The School of Public Health has an amazing funding page. Feel free to explore that. Another attractive approach our students take to reduce the cost of their education is through securing part-time employment through UW in assistantships. Again, I need to stress that our program is full-time and not all students can maintain working in any capacity while in the program. That said, roughly 1/4 to 1/3 of our students secure one of these assistantships for at least 1 quarter during their 6 quarters in the program. Assistantships come in 3 types: teaching assistantships, where you can TA for an undergrad or graduate level course; a research assistantship, where you work on exciting research projects with labs or research groups; or administrative assistantships like the program coordinator for the Veterans Office or the front desk assistant for the Disability Services for Students. The most competitive and attractive assistantships require you to work 20 hours a week. Yet they warrant you 3 things. 1 is hourly pay, 2 is benefit, and 3 is a course fee waiver for the quarters in which you are employed, meaning your employer will pay 95% of this $10,199 due in course fees for each quarter you are employed. Again, I must stress that we are a full-time program and not all students can maintain working part-time or at all while in the program. But we do find that when our students apply for these positions, even though they're extremely competitive and you are quite expensive to employ, they get them because they're not the ones to sit in the back of a classroom to be ready to be lectured at. They know how to pull people out of their shells. They know how to conduct deep and thorough research. So definitely consider that at least sometime in your time in the program if you can maintain it. For more information, visit our website and know that I'm always happy to break down the details associated with the costs for our program. Alumni. I get asked frequently if our alumni are forced to stay in Washington to work because our degree is based in Washington and focused on community health. And the answer to that question is no. Over 40% of our alumni work outside of Washington state across 22 states and 7 countries. 96% of our alumni are employed full-time and 100% are working in public health. Across the various sectors, the vast majority of our alumni are working directly on the grounds with their communities. Then we have almost equal amounts of alumni spread across government, academia, research, healthcare, and a small percentage of public health practitioners. So why COPHP? I always like to share this quote from a 2014 COPHP graduate. COPHP instilled in me that health promotion is more than individual behavior. It's ensuring society creates and maintains institutions and policies that promote social justice and health equity. Social justice is health promotion. So a few more reasons why you would want to consider COPHP. Obviously, the most unique element of our program is that problem-based learning approach. It's very intentional. It's so much work, but we find that if you learn by doing, this is the way to do it. Secondly, I touched on this gently with the example of our practicum director, Jasani Henry, but a very intentional aspect of our program is the majority of our instructors are actually not full-time faculty at UW. Instead, they run their own nonprofits. They are the directors and at the State Department of Health. They are state representatives and Bullitt Prize winners. This ensures our students are learning from experts in their fields, learning about relevant problems within their communities, and complete impactful projects with amazing agencies. Our faculty are current leaders in public health practice, and even though sometimes when they're not teaching, it can be a little difficult to get a hold of because they're off saving the world, we find that all the pros far outweigh the cons and keep us taken out of that ivory tower of academia. We are ranked also among the top 10 graduate schools in the US. I think this year we were number 7. And then UW was recently named the most innovative public university in the world. It's always wise to be skeptical of sensationalized headlines, but I can tell you this for sure. It's really nice being in a small graduate program in a giant university. You're given all the intimacy and support of a small family and all the resources and visibility of a world-renowned university. Gotta quickly touch on Seattle. We are the largest city in the Pacific Northwest. Obviously, with the pandemic, we don't have access to all the same things that make Seattle really great, like the music scene, but things are opening back up and you can still get amazing food and you're super close to the outdoors and the environment's really wonderful. We're a very progressive city. If you ever find yourself in the area, know we'd love to meet you and show you around, so reach out. So if you are at all interested in applying to our program, I'm always excited to connect prospective students with COPHP faculty, alumni, or current students. Reach out to me if you're interested in hearing from those perspectives. Please reach out to me also if you're interested in pursuing a concurrent degree in urban planning or social work. I'd love to have an individual meeting to talk about those details. Lastly, please apply via Sophus and MyGrad. Our admissions website outlines all the moving parts, and reach out again if you need anything at all. This concludes the informational part of the webinar. Thank you for your time and energy. We look forward to hearing from you. Have a good day.